Okay, by treating the horse leg, we can still place the return electrode on the back, because it's very easy to put it there and it's out of the way when you sit working and you're not in the way with the legs on the horse. But first, before we place it there, we have to water the coat on the fur, because to get good connection. So we wetten it, hopefully with some warm water. The horse accepts that a little bit better than the cold water. Just moisten it and wetten it enough, and after that we're gonna add some conductive cream to get the optimal connection. So we use this Skanlab cream or Tenosynovitis cream, because it's made for this machine and this kind of treatment, so we get the optimal electric field through the horse to be able to get the treatment going on the leg. So I add enough cream, massage it down a little bit in the coat, and after doing that we're gonna go down to the leg and prepare the leg as well before we attach the electrode. Okay, then attaching the return electrode, we use a rubber band and put it around the body of the horse in the moist, and then we have this knot which make it easy to tighten the band to get optimal connection. And I put the knot where I'm expecting to have the return electrode, because that gives some extra pressure on the return electrode if it's underneath the knot. Just have to find the band here behind. This is almost like pulling the saddle. He was a little bit thicker than I thought, so we just have to move this, and that's the easy why we have so many holes. We can move this around a lot and use it wherever it's needed. Then we should be good. And I tighten it firm, but not like he's stopped breathing, and I can tighten it even a little bit more. And I do that after putting the return electrode underneath. Then I have put the electrode underneath the rubber band, and I also put the cable just underneath the band. Then it won't be moving around. If the horse moves around, it won't pull the electrode away or something like that. So that's a kind of security for having it underneath there and keep it staying there. Just be sure that you get it proper underneath the knot. The Tenosynovitis Sheath dysfunction is either at the upper part of the leg, just underneath the knee, or at the lower part, just above the fetlock. It's most common areas we have this problem. It comes very often together with a deep digital flexor tendinopathy or even a bow tendon. We see this come together with. But if it's an isolated problem, he is going to treat that Tenosynovitis that is affected, either the proximal or distal. Now we're going to let you show it on the distal part. I'm going to make a demonstration of this. And this is circling and housing the whole tendon, of course, this synovial area. And the treatment is like every diagnosis on treating legs, every day for the first 5-6 days, and every second day for the next week, and every third day for the third week, and 10 to 15 treatments will probably solve a lot of the trouble and make it possible for the horse to come back in training and a rehabilitation program again. On a distal Tenosynovitis, we just put after having water on the tissue, and on the fur we put some cream on the treated area, and we're going to treat medial and lateral and the whole area. And we have on the machine the fixed settings telling us how long the treatment time is, and also the dosage. Starting treatment, you put it on off bottom, and then you move around the tendon and the tendon's synovial problem. Slowly circle movements, a nice tempo, and not too fast, because that feels a little bit stressful for the horse. So nice firm contact and a nice rhythm in your treatment is the best. You can either work lateral side first for the half of the time and then the medial side, but I prefer working the whole area in a rhythm. And if it gets too hot or the horse start to move around and not standing still, we just pinch the minus button to decrease the energy level. It's not always that's the problem that the intensity is too high, but the horse might just need to rebalance themselves and put the legs in other position. And to control the heat, you put your fingers against the tissue and you should feel comfortable warm, not heating, but a comfortable warm. After treatment, it's very necessary and very nice to use water again and a sponge to get rid of the cream as good as possible and dry the coat as much as possible, because that makes the tissue and the skin kind of nicer for the skin, that you don't get too much moisty cream stick there for a long time. And you rub it with a towel or paper just to dry the area to get the rest of the cream and the water out of the tissue. Sometimes it can be beneficial to bandage the horse after treatment to keep the heat there for a while longer after treatment, but not more than half an hour to 45 minutes. And sometimes if it's very swollen, it could be smart and necessary to keep a pressure bandage on them to decrease that the swelling kind of expand and kind of destroy more tissue. And that's especially in the first acute phase.